Hi, my name is Andrew Mays, and I'm a clinical pharmacy specialist in nutrition support at the University of Mississippi Medical Center. Today's course is just one in a series of subjects brought to you by Channel 1 On-Demand Nutrition Education. Today, we're looking at calcium and phosphorus and a brief peek at calcium-phosphate solubility curves. So starting on this first slide, the regulation of calcium and phosphorus in our body are closely regulated and have an inverse relationship when looking at serum concentrations. Calcium and phosphorus regulation is impacted by the serum phosphorus and ionized calcium concentrations in our body. This, along with parathyroid hormone, vitamin D, and calcitonin in the bones, kidneys, and intestines, can impact serum concentrations. Calcium is important for bone structure, blood coagulation, and heart and smooth muscle conduction. Remember, daily needs for adults is roughly 10 to 15 milliequivalents per day and 0.5 to 4 milliequivalents per kilogram per day in pediatrics, which depends on patient age. Phosphorus is important for bone and cell membrane composition, muscle function, and the production of ATP. ATP is required for all physiologic and metabolic functions that require energy. Recommended daily needs for adults for phosphorus is roughly 20 to 40 millimoles per day. And in pediatrics, it's 0.5 to 2 millimoles per kilogram per day. But remember, those pediatric recommendations depend on age. On our next slide, why are we worried about calcium and phosphate solubility? You can see these two pictures here that show calcium and phosphate precipitation. In 1994, the FDA released a safety alert describing 2 deaths and at least 2 cases of respiratory distress associated with PN formulations with insoluble or unstable intermediate. Autopsy confirmed diffuse microvascular pulmonary emboli containing calcium and phosphate precipitation. Even after this alert, there were other reports of death due to pulmonary emboli associated with calcium phosphate precipitation. Moving forward, what about factors that impact calcium phosphate solubility? Calcium phosphate solubility is an important and complex issue associated with parenteral nutrition. Any healthcare provider that prescribes PN should be well versed in the factors impacting calcium phosphate solubility. Compounding pharmacists will ideally act as a second check after prescription for calcium phosphate solubility check. There are several factors that can influence calcium and phosphate solubility in PN formulations. Higher amino acid concentration and dextrose concentration can favor calcium phosphate solubility. Cooler temperature can also favor solubility. Calcium gluconate is the preferred calcium salt to be used in PN compounding due to a reduced availability to form insoluble calcium phosphate complexes. If the final pH of the PN solution is lower, there's a favorable shift for an increased presence of monobasic calcium phosphate, which is more soluble than dibasic calcium phosphate. Pediatric patients may require large doses of calcium and phosphorus, so the addition of cysteine may be needed to further reduce the pH of the PN solution. The lowering of the pH can destabilize total nutrient admixtures, or other known as 3-in-1 PNs. So this is done in dextrose amino acid admixtures, or how we know them historically as 2-in-1 PNs. As concentrations of calcium or phosphate in the PN solution increase, there's an increased risk of precipitation. There are product-specific calcium phosphate solubility curves available. These curves are based upon a fixed concentration of dextrose, amino acid, calcium, and phosphorus. Also, these curves do not take into consideration other components of the PN formula. Even when the limitations of the calcium phosphate solubility curves are present, they remain to be the best guidance in determining calcium phosphate solubility. So we'll talk a little bit about calcium phosphate solubility curves. Calcium phosphate solubility curves should be our go-to method for verifying the compatibility of the amount of calcium and phosphate in a PN prescription. The practice of equations used to determine an estimated amount of calcium and phosphate in a PN should be avoided. Calcium phosphate solubility curve should be used in conjunction with knowledge of the amino acid solution, impact of the other PN components, and potential use of cysteine. A little bit more about calcium phosphate solubility curves. Our y-axis has a calcium concentration. Remember, it's in milliequivalents per liter, and the x-axis has a phosphate concentration, which is in millimoles per liter. Calcium and phosphate solubility curves plot the intersection of those specific calcium and phosphate concentrations within a PN solution in conjunction with, like I previously mentioned, a set concentration of amino acid and dextrose. As the intersect of different calcium and phosphate concentrations are charted on these curves, a curve will form which gives clinicians an ability to predict what concentrations of calcium and phosphate may not be soluble. As the prescribed intersection of calcium and phosphate concentrations move closer to the right of the plotted insoluble points, there's an increased risk of precipitation. And so let's take a look at a couple examples of calcium phosphate solubility curves. And these are from studies that are referenced at the end of this presentation. You can see the plotted calcium and phosphate intersect in blue there. And so you could essentially just plot a line along that. And the closer that you move right toward that line, the higher risk you have for precipitation to occur. Looking at this next section, we have a few different curves plotted, and then there is a trend line charted against to actually make your curve against these concentrations. And like before, the y-axis is your calcium concentration, the x-axis is your phosphate concentration, and those intersects that are charted right there, the closer to the right that you get to that curve, the higher incidence you may have of precipitation to occur. So one would have to reduce one concentration of calcium or phosphate to move the proposed intersect that you have for your current PN formulation to the left to reduce how close it is to that curve. I would encourage you to watch for upcoming Channel 1 videos on nutrition and learn more from my esteemed colleagues. Have a great day and thank you.